Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is not how sane people act. Blah, 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 blah. See, that's the things that are coming out of your mouth, John.
I don't care. I don't care. My jokes don't go over. I don't care. Everybody, I don't care. I don't. He doesn't care.
Wow, that is very interesting. Please tell me more.
Man, you are one pathetic loser.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios in beautiful downtown Tukey City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred to whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POO-IT. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Don't forget stuff.drsteve.com, stuff.drsteve.com for all your shopping needs. And also you can scroll down, see the Roadie robotic tuner, ROADIE.drsteve.com is another place to see it. And the Roadie Coach, they'll teach you how to play an instrument. If you have someone that needs a hobby, buy them a cheap, decent guitar and a Roadie Coach, and it'll teach them how to play. Check out Dr. Scott's website at simplyherbals.net. And check out our Patreon. I'm putting more eclectic stuff on there. And it's basically a collection of everything that we do that's not just the radio show. So check that out. And, as time goes on and I have more free time, I'm going to do more strictly Patreon things. And everything goes there first, then goes to YouTube members, and then it goes to the public if it's not Patreon exclusive. And then if you want me to say fluid to your mama, cameo.com/weirdmedicine. Cheap. It's as cheap as I can make it. They won't let me do it for free. So, but it's very inexpensive. I like doing them. It's fun. And so, order one today. Anyway, all right?
All right.
I do, as we're recording this, DabbleCon is going on. And I do have a new game that you can only get at live events. So you have to go to the live event. But this one's called Dabble Dice. It's the game of beer, splats, and livers. And it's a fun party dice game. And also I have a card game coming out that I'll tell you about when it comes. I have Troy Smith is doing the artwork, and he's taking his sweet time, but that's good because he is doing unbelievable things with this artwork. And when you see it, it will blow your mind. So Troy Smith, incredible artist. I had Conspira Theory, Chris, also known by the Dabblers as Skinny Chad Zumach, is also did the artwork for Dabble Dice. So we've got some really talented people in that universe. But stay tuned for that. If you go to a live event, those games will be there. I'm not going to sell them mail order or anything like that. I don't want to get into all of that. But, selling them basically at cost at the events just so people can have them is something. So check that out. Dabble Dice at your nearest WATP live event. All right. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And check me out on Normal World periodically. And hopefully we'll be doing some more work with them as time goes on. You can just go to youtube.com/@normalworld, and I'm sporadically on there. So I know episode 150, I think I did fecal transplant, and that was a good one. But anyway, all right.
All right.
All right.
Well, while we are speaking, DabbleCon is going on, DabbleCon 2. And I wasn't able to attend this year, but I did send some stuff in. I did the animation with Coke Logic, which was fun. It was some old school stuff. You remember Coke Logic? Tacie used to do all the Opie and Anthony animation back in the day.
Yeah. Mm-hmm.
And he's still around and still amazingly talented. And it was really fun doing the opening animation for the roast. And then I sent my roast set in by video, which gave me the advantage that I could use images and stuff and green screen. And I did a little green screen
tricky poo.
Yeah, I did. And it was loads of fun. And it looks like everyone's having a blast. And I'm sorry that couldn't make it this time, but maybe sometime in the future. Anyway, all right, very good. I'm trying to get the lights in here so that they're not so ridiculous. I don't know if I can. There we go.
Oh, there we
that
go.
Looks good. Thank you. All right. We're actually taking live phone calls today. We used to do this all the time, and then we had to stop for a lot of different reasons. One of the, well, I'm not going to give anybody any ideas, but there was a reason why we stopped doing them.
A number of ideas.
But I have just broadcast this out to our regular listeners. So they're welcome to call in at, it's, if I remember, 754-BEAR-NIP.
Bear Nip.
754-227-3647. You can call in live, and we'll try it, and we'll see. So anyway, I'll try to keep an eye on that. Anyway, Tacie, have you got times of topics today?
I have horrible topics today, so let's get started.
What a nice teaser.
Awesome.
It's Tacie's Time of Topics, a time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello.
Hello.
This comes from the Sun UK edition, so you know that it's accurate.
Okay.
Hot bod, the truth about summer penis and why some men are prone to get it and others.
Whoa. Summer penis?
Yes. Sunshine and hot temperatures can have a positive impact on all parts of the body.
Okay.
Okay, let me figure out where I should start reading.
Uh-oh. Okay, good prep.
As the heat rises, it is believed to have a flattering effect on the length and girth down below. But is it actually a thing? So summer penis is a term people use to describe when a male's penis seems to be a bit bigger and fuller during the hot weather. It's not an official medical thing, just something people have noticed and talked about.
I'm assuming it's cremaster reflex. That when you're warm, you're trying to cool off your testicles because they're very regulated. And when that muscle relaxes for the scrotum, it's also going to relax for the penis as well. That's going to be my guess. Go ahead.
Some men notice that their penis looks a lot larger, especially when it's flaccid. Because of the increased blood flow, it might feel a bit softer or more relaxed than usual.
Increased blood flow should make it feel more full, thick, and juicy.
I mean, I don't know.
I don't know about the
those.
cremaster thing. I'm thinking more it's because of pretty girls walking around in bikinis, maybe.
Oh,
on the beach.
Shit.
Maybe. I'm just saying.
Idiots.
Why do you know?
In a world of showers and growers, this could be considered a way of bringing about some equality. But Dr. Tang did note that if you're someone who's particularly sensitive to temperature changes, you might be more likely to notice the effect. So, I don't know. Have y'all ever had summer penis?
Now, there is a summer penile syndrome, which is different. And that is where tiny mites and poison ivy and stuff cause summer penile syndrome. And it says males are most at risk. Well, yes. But this causes a swollen penis and itchy rash around the genitals. And so this is, mostly affects boys and children assigned male at birth during warm weather months. This is distinct from summer penis syndrome. It can affect adults, exposure to chiggers or other mites, or poison ivy causes this allergic reaction, and you get itchy skin, red bumps, and a swollen penile member. And there are other names for this, and one of them is lion's mane penis. People, anyway, you can tell it's men making up these names because, lion's mane penis sounds pretty manly and awesome rather than just, I've got an itchy rash on my junk. Here's a good one. Trombiculosis of the penis.
Ooh.
Have you ever heard that term before? Trombiculosis?
Nope.
What the hell does trombiculosis mean? I know what it is. Okay, it's because chiggers are in the trombiculid family of mites. So I'm going to give myself a bell.
Always giving each other yourself stuff.
Yeah, mites are not insects. They're in the same 8-legged arachnid family as ticks and spiders. And they're usually too small to see without a magnifying glass. Anyway.
So I have questions that people want to ask about their penis but are afraid to.
Okay.
What is the average penis size? 9 centimeters when flaccid and about 13 centimeters when erect.
It sounds better when you say 13 centimeters than 5.5 inches. Hang on a second. Echo, what's 13 centimeters in inches?
13 centimeters is about 5.12 inches.
Yeah. So it used to be thought that the average male penis was 6 inches, and it turns out that's actually 5. That's erect. So I was very happy to find out about that. Go ahead, Tacie.
A micropenis is defined as a penis measuring less than 7 centimeters. You can get treatment for this.
Okay, so 2.5 centimeters is 1 inch. So 5 centimeters would be 2 inches. So you're talking 2.5 inches. Good.
But this is just the length of the penis on the outside. You might not know it, but there is around the same length of penile tissue inside as on the outside, extending into the pelvis.
Right, which does us no good, but some people will measure their penile length from their taint, saying, oh, no, well, there's penis in there. Yes, that's true, but that's not what we're talking about. When you're measuring it from the base of the penis to the tip.
Yes. Does your shoe size reflect your penis size? The answer is no.
No. I'm going to say no.
No.
Why is the penis shaped like a mushroom? From an evolutionary point of view, it's perhaps obvious that the shaft of the penis is cylindrical or tube-like in shape so that it can fit inside the muscular tube of the vagina.
Yeah.
But there is a ridge between the top of the shaft of the penis and the glans, which is shaped rather like a mushroom. One theory as to why this is known as the semen displacement theory, which suggests the shape of this ridge essentially scoops out and removes any sperm left behind in the vagina by a previous partner who might be a genetic rival evolution.
Oh, that's a weird one.
I've never heard that.
Yeah. Can you break your penis? Well, we all know you can break your penis.
Yes.
Can penises point in any direction?
Ask us these questions and let us answer them, then you answer.
Okay. Yes. Can your penis point in any direction?
Well, define any direction. Can't point inward. I mean, it can't turn around and point inward, but
you can't have an innie.
Yeah, but you can have now you can't have an innie in the sense that their fat pad covers it up. Mm-hmm. I've seen that.
Yeah, true.
Where someone, they're starting off with a flush, flaccid penis, and they have to, push down on the fat pad to expose it. But I would say yes. I mean, it can curve in any direction, really.
As long as it's flaccid.
What does the answer say?
Yes.
Okay. Yeah, if it's flaccid, you just point it wherever you want to.
Can your penis get smaller?
Yes.
Well, define smaller. Now, again, the shrinkage, the shrinkage, the George Costanza shrinkage was cremaster reflex from being in cold weather, and it contracted that muscle, which brought his testicles up closer to his body and retracted his penis into the body. Mm-hmm. But as far as smaller, I mean, I guess anything can happen. If you have reduced blood flow, you can get atrophy of the penis. What do you think, Scott?
I was going to say, a lot of times, especially in as we age, the skin starts to sag and testicles start to sag.
Yeah.
And you would almost think it would get maybe a little longer with gravity.
Yeah.
And
droopier.
Droopy. That's what lack of skin tone.
Droopy
I'm going
balls.
to say no.
I'm going to say yes, but a qualified yes. What's the answer, Tacie?
Yes, your penis can shrink, and there are lots of causes, including high blood pressure and peripheral vascular disease.
Oh, smokers.
Smokers,
yeah.
Low testosterone levels and aging may also affect the size of the penis, as can having a significant curve due to Peyronie's disease.
Yes. Mm-hmm.
Some types of treatment for prostate cancer, such as radical prostatectomy, can affect the size of the penis.
Well, and they give a lot of those guys will have hormone treatment to block testosterone, and it's called chemical castration, or I mean that's one term for it, and that could also just reduce the size of any testosterone dependent tissues. So,
are multiple erections during the night normal?
Yes, absolutely.
Okay, that's true.
Now, do you know how we determine if people are having erections at night? We've talked about this a long time ago. One way to do it is to take old school stamps, and you would wrap them around the penis and then lick the last one and attach it. So it's a band around the penis, and then in the middle of the night, if you have an erection, you will break the band. Mm-hmm. Now, there are manometers or pressure sensors that you can wrap around the penis as well. And we do this for people who have suspected psychological impotence or psychological erectile dysfunction, where you think it may be all just in their head.
Right.
And so if they're having erections normally in the middle of the night, then that lends credence to that hypothesis. If they don't, then it may be physiologic, and you need to do something about it.
And you know what you can also use a little thin piece of Scotch tape.
Sure,
just gently. If you don't have a bunch of stamps laying around, which a lot of kids right now don't even know where to put a stamp on this, which is insane. But
that's true.
But you don't want to put it super tight, just really nice and loose.
Right? Yeah, you don't want it to bind it up. No. They actually make strips for this as well. The urologists have them. So
that's cool.
So they're saying 3 to 5 erections each night.
Yeah.
Showers or growers?
Okay.
I don't know how you could answer that question, but the size of your penis when flaccid does not necessarily predict the size when erect.
That's right. True.
As small penises are more likely to increase proportionally more in length than longer ones.
Right, of course.
A study from the 80s showed that on average, longer penises increased by just under 50% from flaccid to erect, while shorter penises increased by almost 90%.
Jeez.
Nice. Yeah, that makes sense. Mm-hmm. I mean, if you've already got a 14-inch flaccid schlong, it's not going to grow that much when it becomes erect.
You'll run out of blood to your brain. I think we talked about that last week.
Yeah.
Can creams and oils make your penis bigger?
Okay, I'm going to say that's a myth. I know they sell them, and I don't. The only one that I could imagine is if you had Peyronie's disease and they did the injection of the elastase, which breaks up the scar tissue, then that could make it longer. We've covered this before. That there is when Tacie answers this, I'll tell you one way that has been proven that you can improve penis length or lengthen the penis, but it's not with a cream. What does the thing say, Tacie?
No, they can't. The only proven way to increase the size of your penis is by surgery, which can increase length and girth.
True.
What about stretching? Haven't we talked about that with
Yes.
us?
Okay.
Yeah.
So there was a device that used turnbuckle. So it had a Velcro ring that went under the glands and another Velcro ring that went that attached at the base. And then there was a rod with turnbuckles on it between those two straps, and you could twist that to put more and more stretch on the penis. And the research that I read, they were using this for Peyronie's disease. For mild Peyronie's disease, maybe it helps a little bit. People were getting maybe a quarter of an inch, so it really wasn't worth it. Now, the surgery that Tacie's talking about actually doesn't increase the true length of the penis, it increases the apparent length, and that is the suspensor ligament ligation. And what that is there's a ligament that when you were young and you had erections, your erection would point up to the ceiling. That's the suspensor ligament. As you get older, that thing is less powerful. But if you sever it, you can never do that again, but your penis will gain about an inch because it just kind of bloops out of the body at that point. You don't have something pulling it back in. And I believe Liberace, at least it was claimed that he had that procedure, as they talked about it in that movie with Michael Douglas.
Oh, wow.
Yeah.
I do have one more topic.
Cool. That was a good one. Now, you said you had shitty topics. We need more penis questions.
I mean, there's literally only so much you can do with the penis.
Well, okay. Well, and there's vaginas.
To me, it gets a little old.
Clitori, there's boobs, there's rectums, there's all kinds of body parts that we could do.
Well, maybe rectums next time.
Okay, we'll do rectum. I nearly killed them.
Medical myths all about dementia. Okay. Dementia is inevitable with age.
Incorrect.
That's right. This
Only
statement
10%.
is not true. Dementia is not a normal part of aging.
Right. Forgetting the names of your bridge partners is, but that's not dementia. That was actually a question on my board exam recently.
Oh, really?
A person comes to you and they say, they're oriented and all this stuff, but they have trouble remembering the names of their bridge partners. Is that a sign of dementia? And the answer was actually no. That's part of normal aging. It's just you got so much crap in your head that it's hard to pack more stuff in there.
I'm trying to find it too, I think.
Yeah.
Part of it too, just trying to find it.
Yeah. Go ahead, Tacie. Good one.
Dementia and Alzheimer's disease are the same thing.
Okay. The set of all dementia includes all the set of all Alzheimer's, but
yes,
all dementia is not Alzheimer's, but all Alzheimer's is dementia.
Yeah, Alzheimer's is a type of dementia accounting for 60 to 80% of all dementia cases.
Do they say what the other ones are? Because there's several of them. There's vascular dementia, that's mini stroke dementia.
No, they just say although dementia shares certain characteristic, each type has a distinct underlying pathology.
Right, and then there's frontotemporal dementia, or so-called Pick's disease. That's an interesting one, where in some people that have that, they will have this huge burst of creativity. They may all of a sudden be painting. They never painted before, and they pick up the brush, and they're incredible. And then as time goes on, they start losing their ability to maintain relationships, and they become more and more isolated. And they become like the, eccentric artist type, except they never were that before. And so, Tacie, if I ever, start actually playing the piano well, or playing the bass well, or or doing anything like that, keep an eye out, because that may be what that is.
A family member has dementia, so I will get it.
Incorrect. There are some familial dementias, but for the most part, it's sporadic. In other words, it just happens.
It says, although there is a genetic component to some form of dementia, the majority of cases do not have a strong genetic link.
Correct.
Let's see. Dementia only affects older adults.
Incorrect. There is early onset of dementia.
Yeah.
Yep.
Age is a risk factor for dementia, but dementia can affect younger adults in rare cases. People aged 30 to 64 years, 38 to 260 people in 100,000, equivalent to 0.038 to 0.26, develop early onset dementia.
Wow.
In the 55 to 64 age bracket, this increases to close to 420 people in 100,000.
Yeah, so the risk is still pretty low.
Using aluminum pans causing Alzheimer's.
Okay, now I think that this, it depends on who you read.
Mm-hmm.
I think this came from people who were getting dialysis that get aluminum overload, end up with a form of dementia. And I think that people started saying, well, all aluminum, including aluminum chloride or chlorhydrin, which is the one that's in deodorant. Well, aluminum salt in deodorant caused dementia and stuff. And my understanding is that none of that's true. But go ahead, Tace. What's the answer?
Okay. Scientists have not found a clear association between Alzheimer's and using aluminum pots and pans.
Yeah.
However, some research has found a potential role for high-dose aluminum in drinking water in progressing Alzheimer's disease for people who already have the disease.
Wow. I wonder how you would get your water tested for aluminum. I guess you just send it off. But people who receive hemodialysis, aluminum toxicity is a problem. It can be found in unfiltered water used to prepare the dialysate. And the dialysis process does not remove excess aluminum from the body very well. And then you end up with aluminum toxicity, which can cause bone disease, anemia, and dementia. So I'm pretty sure that that's where this idea that aluminum pots and pans were bad.
Gotcha.
They're crappy, unless they're clad. They're not. It's hard to make an aluminum pan non-stick, at least in my experience. Stainless steel, yes. Cast iron, because you can, season it.
Sure.
And I have an iron pan that's not cast iron, and I can't remember the name of it, but it's a certain kind of steel. It's not stainless that you have to season, and it's just as nonstick as any of my Teflon stuff, and it's way more durable.
Okay.
If anybody ever wants to learn how to do it, I'll be happy to.
I'll make a YouTube video.
Yeah. It's easy. You just coat it, wash it off, coat it with oil, stick it in upside down in your oven and heat it up to 450 and set the timer for 2 hours. And then just let it cool down, let it do it overnight. When you come in the next morning, you'll have a nice seasoned pan.
There's your cooking tip on weird medicine.
Right. Well,
always a little bit of something.
It's like
extra.
It's like our Patreon. It's very eclectic.
Yes.
Dementia signals the end of a meaningful life.
No, that's incorrect.
Yes, that is
just
incorrect.
The way they phrase it, that's wrong. We have board questions that are phrased that way, and that it's a political statement that they're making, and what the answer is. So, no, there's lots of people with dementia that have very meaningful lives. I've told the story about my professor in medical school. He had an IQ of like 220. I mean, he's the smartest person I've ever met.
Oh, gosh.
And one of the characteristics of dementia is the inability to name things. It's called anomia. So a normal person like you and me would look at a watch and say, "Oh, that's a thing, a thing that you tell time with," or look at a pen and say, "Oh, that's a thing that you write with." And we couldn't come up with the name pen. When this guy got dementia and got anomia, he would say things like, instead of a deck of cards, he said, "It's a concentric stack of thin laminates." Now, that's only somebody with an IQ of 220 that ends up getting dementia would say something like that. It was amazing. But he had a wonderful life.
Here's another one.
Up until the very end, you know.
Memory loss always signifies dementia.
Incorrect. I have memory loss, and I was worried that it was dementia, and it was just stress.
Yes.
Can't imagine why.
And dementia is always preventable.
That's incorrect as well.
Also
although you can, my understanding is doing things like Sudoku and stuff like that
makes a difference.
Can either help to prevent it or delay the onset of dementia.
Yes. 12 factors can increase the risk of dementia. However, less education, hypertension, hearing impairment, smoking, obesity, depression, physical inactivity, diabetes, low levels of social contact, alcohol, traumatic brain injury, and air pollution.
They didn't talk about lack of sleep. That's a risk factor.
Oh, God, yes.
So that's interesting. A lot of those, I wonder if they are markers rather than causes, though. The social isolation, that person may have been predisposed to have dementia already, may already have some. What were some of the other ones, Tace? Depression can be a symptom of early dementia as well.
Brain injury, air pollution.
Sure, air pollution. That's
certainly environmental toxins.
We're in trouble with that, too.
Yeah.
Environmental toxins have to.
Sure.
Yeah.
High blood pressure could lead to vascular dementia for sure.
Yep. So vitamins and supplements can prevent dementia. This is also false.
Yeah, I was going to say
so what about those things like Prevagen or
without talking about specific types of or brand names.
Because I've thought about getting some of that.
There are things called nootropics or nootropics, and these are medications or supplements that are thought to improve what's called executive function. And those are that's a part of the brain that deals with making things happen, and also memory. So lion's mane is one that's thought to improve that. The Prevagen is, I can't remember what, I think it comes from some jellyfish or something. I've understood, we could do a deep dive on Prevagen if you wanted to, but there are things like that. Modafinil. They will use that as a nootropic for some people. Let's say if you had, a politician that had trouble with their memory or word searching and you wanted them to do well, and say a debate or something, maybe you would give them modafinil or something. I'm just saying, hypothetically, you might do something like that. And so there are those types of medications, Tace, and some of them have some decent data. The question is, how do you determine it? You right now they're using testimonial data for a lot of this stuff, where you have people just saying, "Yeah, my memory's better." Well, okay, that's not generalizable.
No.
And again, if you have let's say a 10%, it's easier to do the math that way, a 10% placebo effect. You have 1,000 people, and you give them your medication and say, do you think it makes your memory better? And 900 of them say, no, this sucks. You still have 100 people that you can use to do testimonials. And now your web page or your TV ad has page after page after page of people saying, yeah, this stuff helped me. But it's complete horseshit.
Right.
Now, I'm not saying their stuff is. I'm saying in that scenario where you are setting out to use anecdotal evidence and exploiting the placebo effect to get a bunch of positive testimonials. So what you really want are double-blind, placebo-controlled studies. But what are you measuring?
Right.
So do you just measure how many digits they can memorize? Well, is that useful? Lists of names or lists of numbers? I mean, how do you measure
store stuff you're going to get when you go to the grocery store?
How do you measure this? And you have to have a measurable outcome, and that's one of the problems. Is that they do have tests for executive function, but does that really improve your quality of life? I'm not sure anybody knows.
You know as well as I do, our brains are so different as far as the wiring and things we're good at knowing.
Yes,
because if you asked me to remember a bunch of numbers in a row, I'd be like, oh shit. But if you asked me to remember, part of a song, I'd be like, oh, that's a piece of cake.
Yeah.
So just different parts of things.
Why whenever we play live, you read everything off of music.
Well, it's called anxiety there, genius.
I know, I get it. I'm just messing with you. So how do you, and you're 100% right. When I underwent a clinical trial and they were looking at placebo versus thyroid-releasing hormone versus dexamphetamine.
Oh, geez, yeah.
And I've told this story before, too, but it's been a long time. When they gave me the dexamphetamine, they would give me these strings of numbers, and they get longer and longer and longer, and then they wanted you to recite them backwards. I could recite a string of numbers 10 digits long backwards on the dexamphetamine, which I could not do during the placebo phase. So, but is that useful?
Yeah.
Does that translate into something that means that you could do something that you couldn't do before, or does it somehow improve your life in some way? And that's the question. So anyway, very interesting.
All people with dementia become aggressive.
Incorrect. Some become very docile, and some get this pseudobulbar affect where they'll cry all the time. And you'll say, well, Mrs. X, why are you crying? Well, I don't know. But then you get some that laugh all the time. And you'll say, how are you today, Ms. Smith? And they, now, for some reason, the ones with pseudobulbar laughing are more fun to be around, even though they're both of them, it's very uncomfortable. Because if you ask them what's so funny about that, they don't know the answer to that either. They're just laughing uncontrollably. But I think even if I had a disorder, I think I'd rather laugh than cry all the time.
Absolutely.
But that's what the Joker had. Remember, he had pseudobulbar affect in the movie The Joker, the Joaquin Phoenix one. And he would give people that card that says, I have a condition that causes me to laugh uncontrollably.
I didn't see that, no.
Yeah, okay. Yeah. Anyway.
Well,
what, you missed a Batman movie?
It wasn't. No, fuck off. It's not a Batman movie.
I'm sorry. Yes.
Dementia is never fatal.
It's because
and
you're
this
an
is
idiot.
the last one. Dementia is never fatal.
No, it is very often fatal. I mean, it leads to death.
Yeah. Approximately 13.6 of deaths were attributable to dementia over the period of 2000 to 2009.
Yeah. Now, again, this is sort of like they're getting that from death certificates. So some doctor wrote cause of death, dementia. And that's not really correct. Dementia can be a contributing factor for sure. You don't usually die of dementia. What you die of is you wandered out in the street and got hit by a car, or you didn't eat, so you got malnourished, and then your immune system tanked, and then you got a urinary tract infection that killed you. So your death certificate should say, sepsis, secondary to urinary tract infection, secondary to malnutrition, with contributing factor of dementia.
Right.
So really, dementia should not ever be the proximate. These studies where they do death certificate stuff really tells you more about the quality of death certificates being filled out in this country, because it's a pain in the ass for everybody. Nobody likes filling out death certificates.
Okay.
It's a lot of paperwork, and they'll just rush through it. And when the CDC had that statistic said only 6% of people had COVID as their cause of death, and people jumped on that saying, well, see, COVID. No, they were just coding it incorrectly. Right. It's always respiratory failure due to viral pneumonia secondary to COVID-19 or whatever. You always, and people just don't take the time to fill these things out properly. So a lot of these studies that look at types of death based on death certificate database searches just really say more about how shitty the death certificate process is in this country rather than anything really serious about the data they're looking at. All right?
Pretty wild.
And that concludes my topics for the day.
Yeah, those were pretty good.
Good.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Did you guys know there are butterflies that drink blood?
Or that there's a species of beetle that can shoot boiling liquid out of its butt?
Or that blue whales are so big you can swim through their arteries?
But there's a species of bat that's so small that it weighs less than a penny.
My name's Maya.
And my name's Connor.
And we are the co-hosts of World's Wildest Podcast. If you guys love nature and you love learning about how crazy it is, Connor and I have over 30 years of experience in wildlife conservation, and we're here to tell you all about them. World's Wildest will take you on a journey to meet Earth's most extreme creatures, from the world's strongest to our world's smelliest.
Make sure to subscribe for new episodes every Thursday wherever you get your podcasts.
Are you an overthinker? Then I have a podcast recommendation for you. Introducing the Magical Overthinkers podcast, a show for thought spiralers, exploring the subjects we can't stop overthinking about. I'm your host, Amanda Montell, author of the New York Times bestselling book, The Age of Magical Overthinking, and host of the Sounds Like a Cult podcast. Every other week on Magical Overthinkers, I interview a brilliant expert guest about a buzzy, confounding subject from the zeitgeist. Think narcissism, social media comparison, imposter syndrome, girl math, complete with thought-provoking conversations and actionable takeaways for how we chronically online listeners can get out of our own heads. This podcast is here to make some sense of the senseless. Listen to Magical Overthinkers now, every other Wednesday, wherever you get your podcasts.
I enjoyed that anyway.
I thought it was pretty good.
We got any questions from the Fluid family there, Dr. Scott?
Not yet.
Okay. We're taking calls and no one's calling.
That's okay. Okay. Mick KM says, in case you get time, thoughts on maybe this is one you know, ampylopsin extract. Do you know anything about it?
Are you in the Fluid family?
Yeah. It's herbal being studied for hepatoprotective, anti-inflammatory, and multiple mechanisms of anti-cancer. Are you familiar with that one?
Never heard of ampylopsin?
Ampylopsin.
Never heard of it.
Yeah,
never heard tell
that
such.
one.
I'll look it up.
I have ampelopsis, commonly known as pepper vine or porcelain berry. But I don't know anything about that. But I'm always interested in new supplements and stuff. I think that it's very important that we understand these things as allopathic providers.
Wait a minute. It says it's being used as a hangover treatment.
Yeah, and to treat cough, fever, and pharyngalgia, which is sore throat. Says it's widely distributed in southern China. I wonder if that's the same thing. We'll look into that. Let's have a note for us for next time, Dr. Scott.
I'm on it.
Yep, you stumped the chump on that one, my friend. But, all of our... I never crap on supplements. I may crap on some of their claims, but I don't crap on them because most of the medications that we have in this world today were derived from plants or bacteria or fungi and stuff like that. So there is stuff out there that we do not know.
Right.
And I do think that the next breakthrough in depression and PTSD is going to be from the Cubensis psilocybe mushroom.
Mm-hmm.
So I'm very interested in seeing the research that ends up getting done on that. But anyway, did you find anything else before I move on?
No, I'm looking. No, yeah. I'll look it up for next week, though.
Yeah, sorry, Mick. I don't know, but we'll see what we can come up with. All right. Let's see. Jabroni said, Jabroni, I get it. Hey, Doc, You killed at DabbleCon 2 last night, even if you weren't there. Yes, I submitted my roast set by videotape. And he said, shh, I won't tell Blind Mike. Yeah, sadly, that was one of my jokes, that Blind Mike didn't know I wasn't there. But anyway, my favorite Blind Mike joke, though, was very visual, is that his wife is out to get him. She keeps leaving the plunger in the toilet. Think about it for a second, and then there you go.
Oh, God. Oh, my word, that's terrible. Poor Mike.
All right, let's see.
Number one thing, don't take advice from some asshole on the radio.
Okay, this is a Tacie DeLoach from 2015. This is from 9 years ago, and I found it in my collection of voicemails that have not been answered. So let's see.
So, you're wanting to know different ways of measuring the size of an erect penis.
Oh, and wow, this is completely a coincidence, but totally apropos to our discussion. So let's see what he says.
Well, what I do is I wait till the girlfriend leaves, and I take me a couple of Viagra's, and I walk around the trailer, and I find different things to stick my pecker in.
Oh, Jesus.
Don't ever turn anything on like a vacuum cleaner, hose, or...
Yeah, please don't do that. People are tempted to do that. That's a mistake. Please, if you're gonna put your erect member in something, please make sure it's something that was designed for that. And they do you can buy things that you know that are designed for that. Use those. Don't improvise. No tree knots. No vacuum cleaners. None of that stuff. No belts on a wheel. You remember that story of the guy that was rubbing his junk on the belt of some industrial wheel, and it grabbed his scrotum and threw his testicle right out the window.
Yep.
And then he was so embarrassed, he stapled his scrotum back together, and about 3 or 4 days later, he appeared in the emergency room with a rip-roaring case of a pelvic abscess and Fournier gangrene, which is basically necrotizing fasciitis of the juncal region.
Yuck.
Yep. So anyway.
Paper towel rack, toilet paper rack, or I'll have a toilet paper roll, or I'll go through the cabinet, buy me different glasses, and stick my dick in. When I find something that just lightly touches around all the way around, I measure that glass. Just for the record, I'm double digits.
Okay. Yeah, it's in centimeters.
That doesn't even sound like him.
Yeah, it is.
I think he was trying to hide his voice.
This was a long time ago, okay. So I think it was before he was even in the studio. Why not just measure your dick? Yeah. Why stick it in something and then measure that? You can just measure it directly.
That's Tacie just showing off.
Okay, well, all right. Very good. Thanks, Tacie.
Hey, Dr. Steve. I just had a quick question. About a week ago, I stopped smoking marijuana after smoking it for about 10 years. I was a heavy smoker, smoked about 3 times a day.
Okay.
Like I said, haven't smoked in the last 7 days, and I haven't had more than an hour's sleep in any of those days since. Last night I tried Unisom and probably had the best night's sleep I've ever had in my entire life. But then I tried Unisom again tonight, and I can't manage to fall asleep. I've tried getting up super early, staying up super late, trying to fall asleep. Nothing is working. I just want to know, how do I go about getting back to a normal schedule without having to take all these drugs all the time?
Right.
Anything you can do to help is greatly appreciated.
Yeah,
Thanks,
man.
sir.
Well, congrats on your sobriety, I guess. I can't imagine getting baked 3 times a day like that. No. So your cannabis receptors in your brain were upregulated, meaning that when you were filling them up with exogenous, in other words, out-of-the-body cannabis cannabinoids, the body made more receptors. So now you've got a whole bunch of receptors that now are not being stimulated at all. Although THC is not considered addictive in the classic sense, there can be a withdrawal syndrome. Just like you can have a withdrawal syndrome from Cymbalta. I had that. It's not addictive, but I still had a withdrawal syndrome. Anxiety, irritability, anger, aggression, disturbed sleep, depressed mood, loss of appetite, stuff like that. Some people will even have chills and headaches and things like that. So The good news is that these are not life-threatening. They are lifestyle, an assault on your lifestyle. There are medications that you can use for short-term symptoms. The Unisom is basically an anticholinergic. There are other medications that you can use. Anticholinergic like a Benadryl type thing. But you can wear this out as well. And it probably takes maybe a week to 2 weeks before your cannabis receptors reset themselves. It kind of sucks in the meantime, but hang in there. If you quit because you want to be sober during the day, it's okay to be sober during the day. You could talk to your primary care provider, and maybe they could give you a short term of something to get you through the next couple of weeks. But honestly, there just isn't. There's not a whole lot that there is that you can do for this, unless Dr. Scott's got some ideas.
Yeah, I've got a couple of it. Certainly, he can try certain things like melatonin. He can try things like magnesium at bedtime, things that might help him go to sleep. He could consider some CBD oil. In a capsule at bedtime. So it's not THC.
That's kind of an interesting idea.
Yeah, I mean, I'm not saying it because it doesn't have the
and then taper off of that.
Yeah, because it's going to be at least going to stimulate those cannabinoid receptor sites, but not get him high or stoned. I use the Simply Herbal Stress Less a lot of times at sleep just to calm down my monkey brain.
Yep.
But I have chronic classic insomnia, so it's something I battle every single night my whole life. There are a bunch of other options out there other than just a Benadryl, or a hypnotic, like you might see if you get like an Ambien if you go to your primary care doctor, or benzodiazepine, something like that to get you over the hump. But
now, there has been a study of people where they actually used dronabinol, which is the synthetic THC, and just weaned them down from that.
Gotcha.
And it's going to be off-label, and your insurance won't cover it for that. But it is now generic, and it's back on the market, and it is relatively inexpensive, given how much you would actually use. So, so that's an idea as well. But that's sort of a.
And the other things, like some of those soothing sounds you can play that kind of put your brain to sleep at night. Sometimes those will help you too, especially like I said, if you're like me and you've got a crazy monkey brain at night, it's just you have to try everything you can do.
I'm looking at some clinical trials. Some of them used a medication called bupropion, which is that one is Wellbutrin, right, Tace? Buspirone is Buspar. So bupropion is a more dopaminergic type antidepressant. They use it for weight loss, for quitting smoking, for the withdrawal syndrome for that. And so I'm assuming that's why they tried it in this. They've used extended release Ambien for this as well, and then a couple other drugs like SSRI antidepressants. And some of these had decent results, some not so much. If this person wants to email me, I could send him a copy of this study, and they could take it to his primary care and see if he needs anything. But I'm going to bet that if he detoxes on his own with some good nutrition and getting exercise and doing the things Dr. Scott said, maybe trying a little melatonin.
Try that first,
get through this pretty quickly. I do like your idea of CBD, and I do not see a single clinical trial that tried CBD for this, but it is cannabinoid receptors.
Right.
It just hits them a different way. I just don't. It's very interesting.
Well, it's probably and sadly, it's probably because there's just no money in studying the CBD versus some of the prescription medications.
Give thyself a bell.
Yeah,
What the fuck ever.
Well, I'm giving him a bell because
Suck it.
That's one of the problems with medical research is if you can't make any money off of it, it's going to be hard to get it funded. So,
and that's understandable.
Yeah, well, it is understandable. It's still
not good.
Sucks.
It sucks, but it
that's why there are governmental agencies that will fund studies that otherwise couldn't get funding, and sometimes good stuff comes out of that.
Yep.
Anyway, all right.
Cool, man.
All right. Let us know how you do, my friend. Okay.
Dr. Steve.
Hey.
This is Bob from Peoria, Illinois.
Hey, Bob.
I've been listening to your show for quite for years now.
Hey, thanks, man.
And I'm wondering, I have had this problem for several years now, and nobody gives me an answer. We've tried everything. If I'm walking along and just doing anything, and I sit down,
yeah,
a lot of times I get very dizzy, lightheaded more so than dizzy. I would say lightheaded.
Yeah.
And nobody's given me an answer to this. I've been checked out every which way but loose, and I have not got an answer. You know, if you put a thing in, it always talks about standing up quickly or sitting up quickly, but it doesn't have anything about sitting down.
Right.
So I wondered if you might have an answer for that. I would really appreciate it.
Yeah. So he has positional near syncope. In other words, he feels lightheaded or near fainting when he sits down rather than stands up. And you have to wonder what mechanism could be causing a decrease in blood flow to the brain when he sits down. Now, it could be just a really distorted autonomic system, but there may be a kink in a vessel.
That's what I was thinking.
Somewhere that's causing a problem. And so I would. This is what I would do. If he were my patient, I would order a tilt table test. This is where they put you on a table and they move you. They put you in all these different positions and check your blood pressure and see if you faint and things like that. And you can almost always pinpoint the cause. If they set him down but his legs are straight and it doesn't do it, but they do it with his legs bent and it does do it, then that starts to speak toward a mechanical problem.
Right.
The other thing is I would do ambulatory blood pressure on him. You know, he could be getting lightheaded for other reasons other than his blood pressure dropping. And it could be even, it could even be psychological at some point. And then the last thing I would do is an event monitor. Where when this happens, he pushes a button and you can see what's going on in the old ticker. Is he having some weird arrhythmia that only happens when he sits down for some reason, something that's triggering it? And then you just go looking for things. A vascular surgeon could figure this out if they think it's mechanical.
That's what I was going to say too. You know, because you might see similar kind of things in females that are very, very, very pregnant.
Yes.
And sometimes in guys that have an extra large belly, sometimes that'll cause that trapping too. Like this would be a vascular or mechanical problem.
Yeah. He didn't say how big he was.
No. And not saying that he is, but it certainly could be something like that.
It's interesting. So that's what I would do. That's kind of the workup for that. And it is weird that it's the opposite of what you're used to. All right, let's do this one real quick.
Hi, Dr. Steve.
Hey.
I'm calling about a subject you just talked about recently, and that's the calcium score.
Yes.
I recently had one, and much to my surprise, it came back not that great.
Okay. What was the number?
I was kind of shocked. I wasn't expecting this at all. It was more just let's check and see. And part of me is glad it did come back at 171.
Okay,
which,
171.
I'm 58 years old.
Okay, so at 171, this is considered a moderate amount of plaque. So this is the calcium score. You go to the CT room and they run you in between cases, usually charge anywhere from $50 to $100, and it looks at coronary calcium. And it goes from 0 to over 400. Over 400, those people have a high risk of heart attack. 101 to 400 is considered moderate, and your chance of heart attack is moderate to high. So my question would be, what are his other risk factors? So they recommend statins if your risk of having a heart attack is greater than 7.5 to 10%, and that's your 10-year risk. They recommend a statin. So what lifestyle things could you do to prevent heart attack and stroke, or to improve your cholesterol, I guess is the question. What I used to tell people when I was in primary care was increase your fiber. And if you can't increase it dietarily, take Citracel.
Yep.
Citracel is a fiber supplement that doesn't cause flatus. It's not digestible, but it has been shown to decrease the bad cholesterol. And oat bran as well, so you could do that. Getting some exercise will increase your good cholesterol. And if you're a drinker, 4 ounces and 4 ounces only, Tace, of red wine or purple grape juice if you're not. And then what else we got?
Well, a couple other things. You can donate blood.
Yeah.
Donate blood does work. I've actually seen it firsthand. Saw it literally yesterday.
Yeah.
Some labs came back on a friend of mine. Let's just say that did the diet had lost 20 pounds.
Yeah,
had increased exercise. Starting to play pickleball.
Yeah,
and is literally transitioned away from red meats and chickens.
Yeah.
Even though I know those things can be wonderful at times, but gone more to fish and vegetables.
Yeah, be careful with the fish, though.
Yeah, but
eating it more often than recommended, you can end up with mercury poisoning. I've seen that.
Right. Well, let's just say Mediterranean style diet.
Yeah.
So
Gotcha.
something along those
sure.
lines. So and a profound change. And the only other thing that this friend did was donate blood, which the blood center needed it anyway.
Yeah.
Yeah. Donated blood and came back and the labs all looked just fabulous.
That's awesome.
So there are a lot of things. I mean, and the medications can be super helpful too. But they're not always the only option. There's a lot of other good options. So.
They have been shown to decrease the risk of heart attack and stroke in people at high risk, and so that you don't want to just throw statins at people. But there was a time when we were saying we should put it in the water. They were so amazing that we should put it in the water. Thank God we were not stupid enough to try to do something like that, because there are definitely adverse effects.
Yep.
All right, very good. Let's hit the chat room. I'm going to shut down the call screening software. Thanks, everybody, for that one. That's okay. That's I just wanted to see what happened. Now, maybe next time I'll put it out on Twitter, and we'll get some more lunatics calling in. But everybody in our chat room is very well behaved. So, what do you got over there, Scott?
Well, it's actually a pretty complicated question from Matt.
Okay.
Yeah, so Matt's got a son that's 22 years old now, was diagnosed with ankylosing spondylitis at the age of 6 by Mayo Clinic. He said the medication that he was taking had been helping him, but is not working now. Okay. And was wondering if there are any other suggestions, herbal supplements, anything like that. And my first question to him was, what had they been giving him that had helped his ankylosing, and how had it helped?
Right.
Because with ankylosing spondylitis, that's a pretty complicated,
so
disease progression.
Juvenile ankylosing spondylitis.
Yeah, and there's been some research and some suggestions that you can identify that much earlier than previously based on some GI dysfunction. So what they're seeing is a correlation between a gut dysbiosis and healthy bacteria in your stomach and a possibility if you're that being a precursor to the ankylosing. But anyway, so my question to him is it helped slow the progression of the ankylosing, or is it helping him more with the pain and dysfunction?
Yeah. So let's talk a little bit about juvenile ankylosing spondylitis. Is basically an arthritis that affects the spine and the places where the muscles and tendons and ligaments attach to the bone, and those calcify.
Right.
And so ankylosing means stiff. Spondylosis means, pertaining to the spine. And itis is inflammation. So you're talking about stiff spine inflammation. And, I'm not aware of a supplement that can change the course of this. But speaking to Scott's idea of gut dysbiosis, which wouldn't hurt anything, if, yogurt and kombucha.
Yeah, foods that are heavy.
I like kombucha because it has multiple bacteria and yeast as well, because we need all of those things. I would want to know what this child's HLA phenotype is. There are groups of genes called these HLA antigens, and they play a major role in these things. And the HLA antigen that's associated with juvenile ankylosing spondylitis is the classic HLA-B27. So, most people with this do have that, and it's important to know for that the child's future offspring that they may be at risk.
Yeah, and as far as any kind of supplementation, it just really depends on, again, what he's shooting for.
Yeah.
If it's the pain and arthritic changes, things that probably will not hurt would be things like curcumin, anti-inflammatory stuff.
That's a non-steroidal anti-inflammatory drug.
Ginger root's been shown to work pretty well as an anti-inflammatory. Astragalus, I know you'll love that. But
fine. Whatever.
But it's not gonna cure him,
right?
But the other things are going to be things. I would be more.
No, he's sick, so I would not.
He's 22.
Oh, he's 22.
Yes,
he's had it
Steve. I'm sorry.
6.
Yeah, he was diagnosed as
okay.
age
Sorry.
6. Yeah. No, but what I would really, really, really focus on is the movement of his ribs, and his spinal cord. So I would work a lot on yoga, exercising, things of that nature, just to try and to maintain as much flexibility in the lungs, because that's what we see a lot. It is obviously the pain, but the side effect of ankylosing is a decreased movement of mobility, ribs, which makes you a little higher risk for flus and pneumonias and things of that nature.
Sure.
So that's what I would really focus on.
Yeah, yoga is basically a form of self-directed physical therapy.
Right.
I'm really convinced that yoga was invented 4,000 years ago by a guy in India that had back pain.
Exactly. Had to be.
So, but anyway, physical therapy, seeing a physiatrist or a physical medicine and rehab specialist.
Yes.
When I say physical medicine rehab, if I tell somebody I'm going to send you to physical medicine rehab, they go, well, I'm not going to no nursing home. That's not what we're talking about. We're talking about a specialist, and they need an ology name, but physiology is already taken, so they're called physiatrists or physical medicine rehab specialists. And they deal with this kind of stuff. They can directly put needles in the spine at places to relieve pain and to promote flexibility. You could see somebody like Scott, as long as they have DOM after their name, so that they are a diplomat of Oriental medicine. That means they did 4 years of traditional Chinese medical school and not some weekend warrior that just took a class on acupuncture and put out a shingle.
Exactly.
And that may be helpful as well for pain and flexibility and stuff like that.
Right on.
But unfortunately, we just don't have a medicine that will just fix this. Now, I'm hoping that with CRISPR and those kinds of things,
where you gene editing,
do some gene editing. In the future might be the thing.
And he did say he was taking Taltz, which is a biologic. And so, and sometimes, and Dr. Steve, you know a whole lot more about this than me, but sometimes with a biologic, they can change to, if one's not working, they can change to a similar biologic that might possibly, if you have but Mayo Clinic, they're going to be leaders in this kind of thing. So, but I would supplement it with all this other stuff in addition to what they're doing.
Okay.
Yeah,
very good. Now, Mick was talking about dihydromycin. So, he said there's some studies.
But that's that same stuff. The ankylosing I'm looking up.
Yeah.
And I'll work on that for next time.
Yeah. Okay. We'll look at it. Mick KM, stand by. He says that it probably proven GABA modulation, in other words, gamma aminobutyric acid modulation, which is the same receptor that things like Valium and those sorts of things will attach to. Mm-hmm. But he said it helped him, and and that's great. I'm glad it helped you.
Shoot, yeah.
I would like to see some randomized studies that are generalizable, but we'll look into it. That's one I don't know about, so I want to know more about it. Okay, let's see here. Goody Two Shoes says, word on the street is that Dr. Scott's nasal spray gave Steve the confidence, mental clarity, and inspiration for that incredible roast the other day.
Guaranteed fact.
That's true. I use it every day.
Goody Two Shoes, you're so right.
And Mac Fecto says, we both met you in Detroit last year. Hope to see you in Detroit this year as well. I will not be going to Detroit this year. Sorry, I'd love to, but Yeah, I didn't have a good time there last time. John's ear mites, member for 6 months. Pescado Joe, thanks for the $4.99. Great job on your roast. I thought it was the best one out of all of them. Thank you, but that can't be right. Make sure to wash your fingers of the Rocco stink. Yes, because I did a simulated prostate exam on Rocco. I pulled footballs and flowers and stuff out of his rectum. And there you go.
Cross state line.
Why did Leo Gunn get a message retracted? Oh, Leo, I'm sorry about that. Jake Hudson is there. Hello, guys. Let me see. Jake Hudson says, thank you very much for the video you did for my birthday. I was happy to do it. I would have done it for free. He did it as a cameo. So if you want a cameo, cameo.com/weirdmedicine, it's almost free. Very cheap. $5 at most, usually. Chris Primer gifted 5 Weird Medicine with Dr. Steve memberships. Thank you, Chris. And make sure that you turn on your gifted memberships, because from time to time people will gift memberships and they're only 99 cents. So every once in a while someone will come in and gift people like 10 or 20 of them. And if you have your gifted memberships turned on, you may receive one of those. Tickus says, love you, Dr. Steve. I'd let you stick a finger in my ass in a non-intercourse way and totally not get you in trouble. Thank you, my friend. I appreciate that. I think my days of sticking fingers in places that they're not supposed to go in public are over. I think Tippy Tom was the last time I did that for real, and that was the culmination of my prostate exam on Opie and Anthony. And as a matter of fact, when I finished with that one, and it was my idea, and when I finished with it, I turned to Opie and I said, can this bit be over now, please? And so they allowed me to stop doing that. Anyway. All right. Chris Mack says, was yoga invented to keep young men flexible and limber as they went through puberty to ensure they'd be more effective warriors in adulthood? I think I read that somewhere. I don't know. But that's a fascinating hypothesis. All right, you got anything else, Dr. Scott?
I don't believe so, sir.
All right, well, thanks, everybody. We appreciate everyone being here. Thanks for all the kind words. Thanks always go to Dr. Scott. Tacie, thanks to everyone who's made the show happen over the years. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7, Sunday at 6 p.m. on demand, particularly on demand. Please listen to it on demand. And other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Go to Dr. Scott's website at simplyherbals.net for the best CBD nasal spray on the market, in my opinion. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.